Sentinel events occur when the nurse or person caring for a patient makes a mistake that leads to negative outcomes in that patient's treatment. When nurses are changing shifts, they must give all of their patients' information to another healthcare provider, and this leaves a wide window for mistakes and sentinel events to occur. Here is an example of a poor patient handoff that leaves the patient at risk for bad care and negative outcomes.
She drove her car into traffic.
Oh,
I guess she's schizophrenic, so
great.
there's that. And then, yeah, that's why she has this brace on her arm, because she has a left fracture or break or something.
So why does she have this?
I don't know, they just brought it in here, so I just left it there. I haven't really done anything with it.
Okay, you should probably put this on.
Okay, so, let's see. Other than that, like, she's just been kind of crazy.
Oh.
So, good luck.
Oh, thanks. I just really don't want to work today.
Yeah, it's like one of those days.
I know.
But anyways, so like I said, she has schizophrenia, she's crazy, and she's only like 20 years old. So, anyways, let's see. She's breathing fine. She came in with rapid respirations, but I think they have it under control. Her pain, she said, is like an 8 out of 10, but I don't really believe that.
Yeah, I really doubt that.
Yeah, I think she just wants the pain medicine, so.
Does she talk?
She just kind of like mumbles and acts crazy. That's what she does.
Okay.
So she kind of like looks off in the space. I don't know. But you can look at the rest of this, see what you think. So, anyways, well, is that all you need from me? Because I really need to get out of here.
Okay, I think so.
Okay, cool. Have fun with her.
Guys, I have such a crazy patient today. I just don't want to
Really?
do this. I just want to go home.
Who are they?
She is Sarah Davis, and she has schizophrenia. She's 20 years old. Yeah, she's acting kind of crazy.
That sucks.
Yeah. So, hopefully this day goes well.
Mine too.
As you could probably tell, that patient handoff was extremely unprofessional. The nurse giving the handoff did not allow adequate time for the nurse receiving the handoff to ask questions. They called the patient crazy, they discredited her complaints of pain, and they shared her information with people who were not related to the case. This patient later had complications related to pneumonia, as the nurse receiving the handoff was never told the importance of her incentive spirometry relating in poor patient teaching. In this next handoff, notice how the nurses actively involve the patient and allow adequate time for all pertinent information to be relayed. Yeah, so this is Sarah Davis. Hey, Sarah.
Hi, Sarah.
She is 20 years old. She has a left broken arm right now from a car accident. She also has 3 fractured ribs on her right side. Her admitting physician is Dr. Hartley, and her consults are Dr. Kittner.
So she had a car accident?
Yes, she was actually going down the highway without a seatbelt on. She was hit from behind and ejected from the windshield. So she has quite a few extensive injuries. She's got a few surgeries planned, so we'll see what happens. She was admitted on the 21st of April. She has no known discharge date, again, probably because of the surgeries. And she has no known allergies as well. She's a full code status, and she has all of her current immunizations up to date. Yes.
Okay.
Yep. She has 55 kilograms as her weight. She does have a medical history of schizophrenia.
Oh, okay.
Yes, it's pretty extensive. We don't know if she's on any medications or anything right now, but I'm assuming that's something.
Do you know if she's had a consult yet?
She does have a consult planned, but it probably won't be until after her next surgery on her leg.
Okay. Are you aware of what doctor it is?
Dr. Morgan is actually the one going to be doing her psych consult. She has had an appendectomy and a tonsillectomy as far as the surgery history goes. And then she has oh, I'm sorry, we have maintained a patent airway as our main goal today. So we want to make sure she's still breathing. She's on a lot of morphine. And then, of course, managing her pain level is also going to be one of our top priorities. So.
Do you know what pain medication she's, like as far as PRN meds that she's been taking?
Just
the morphine?
Yes, she's on the morphine. That one's more of mandatory, and then she's also taking Percocet PRN.
Okay. Are you aware as to the last time she took that in your shift?
Percocet was given to her this morning around noon. And then she had her morphine, of course, around the same time.
And you said something about an incision. Was it?
Yeah, let's go ahead and take a look at that. I'm going to open this up, Sarah, okay? It's nothing major. She just got caught on the glass, I'm assuming, from the windshield. So it's about... Yeah, absolutely. I'm going to get some gloves on as well before we open this up, Sarah. But it is about a 6 to an 8 inch incision. They're going to open it up tomorrow and debride it. They're going to set her bone and then get her sewed back up. And so
Okay.
she probably won't be walking for quite a few weeks.
I would say so.
Sarah, is your pain very high right now?
What would you rate it on a scale of 10?
Probably an 8.
8? Okay. Where are you having your pain at?
My arm hurts a lot.
Okay.
I wouldn't say that hurts too much.
Do you have any sensation in it?
Yeah, I can feel
You
it.
can feel that? Okay.
You can go ahead and open that up. I did dress her earlier, just a couple 4x4s.
Okay.
The doctor wanted to see it though before we got everything finished. But
Okay. Oh wow. Yeah,
that's what it's looking like. Do you want to get me the replacement 4x4s? We're going to put those on real quick. Awesome. Alright, so I'll need you to take back up here. So, as I was saying, Morgan wanted to wait until after this was looked at before he came and did his site consult. And I'm sure he's going to get her back on some Halidol or something like that.
Are you aware if she is having any hallucinations?
She is having some hallucinations, auditory hallucinations. She's kind of talking to herself earlier. Caught her doing it. She doesn't acknowledge to me that they are there, but I do believe that they are there.
So it's more auditory?
Yeah, and visual for
Okay.
sure.
Alright.
We do have a set of vitals for her. She had 100 over 70 for her blood pressure. Her heart rate was 110. We think her body's probably compensating for the lost volume. She has a temperature of 99.8 and 24 as her respirations, and she's on 2 liters of oxygen as well.
Her respirations, do you feel that, are you guys aware of whether that's because of her ribs or?
Most likely she's got shallow respirations because it's painful. Is it painful to breathe in for you, Sarah? We think that's why she's not taking as deep of breaths, causing her body to need more oxygen, increasing her respirations. So, once they take a look at the leg, they're going to open up the abdomen probably, or at least get the ribs figured out.
Mm-hmm.
Go ahead.
As far as her vitals, how is that from her baseline? Is that?
She's trending up. Her blood pressure was very low when she arrived, and her heart rate was actually a lot higher than it is now. Her temperature used to be about a 103
So
when they brought her in. It was very high.
So you guys got that down?
Yes, so she's trending back to normal. She has a blood sugar of 120. She has no history of diabetes, so that's about right. She has had a CT on her head to make sure that her brain isn't bleeding, and they did a chest x-ray to visualize the ribs that she has broken. And then we have an order for an IV that they're going to be putting in her right AC space sometime soon.
Do you know what
Yes.
they're planning on?
I believe Dr. Hartley wanted to start some albumin just to help her start healing, of course, and then also to bring her fluid volume up.
Okay,
as
so
well.
that'll pop up on the orders pretty
Yeah.
cool.
Yeah, I'm assuming that should be shortly after I leave. We also have an assessment done that I've done today. So, as I mentioned before, she has the auditory hallucinations. She is oriented ×2. She knows Sarah, you know your name, and you know what time it is. But she doesn't know where she is. I'm assuming she woke up here, so that might be a little difficult for her to get a grasp on.
She's kind of still clearing up.
Yeah, she's been pretty slow since we gave her the morphine too, so. She has the shallow respirations and the pain on inspiration, as mentioned. She's starting to get a little bit of crackles. I think it might just be because she's been pretty still all day. She hasn't really moved a whole lot.
The other opportunity to breathe in and out.
Yeah. So you might talk to someone about some incentives for telemetry, just to keep those secretions mobilized. She has tachycardia and low tissue perfusion, as well as a little bit of pallor, especially on her lower extremities. I'm assuming her heart's trying to just keep her right.
Compensate for everything.
Yep. She has hypoactive bowel sounds. She hasn't
really eaten anything?
She hasn't had anything since she got here. They're thinking maybe TPN if she can't eat after surgery, but I'm not exactly sure yet. You might ask Hartley about that as well. She has limited range of motion, of course, in her leg and in her arms, both of her arms, because of the ribs on her right side as well. Really, the only full range of motion is on her right leg, and then she has muscle weakness as well. That could be from not eating, that could be from low tissue perfusion, that could be from a lot of things. But,
as far as her input and output, are you aware of how her...
like I was saying, she hasn't had a bowel movement since she got here. She also does have an order for a catheter because they did see a little bit, I think about 500 cc's of urine in her bladder.
With the bladder scan?
Yeah.
Was that before she came up here?
That was actually one of the first things they did.
Okay.
Because they wanted to open her abdomen up, but there's a few things we need to get done first.
Sounds good.
She has lesions on both arms and hands, and she has road rash covering about 25% of her body, mostly on this side and up into her arm as well, under the splint that they have on there. That's probably where a lot of her fluid's getting lost at as well.
So we'll get those fluids hung up as soon as...
Yeah. Yep. So right now she is NPO. The doctors have her on no walking, no ambulation at all. They want to keep her in the bed until they get everything figured out. So she does have that side consult with Dr. Morgan. We talked about a little bit about the incentive spirometer, and then her follow-up care will be put in by the doctors as soon as the surgeries are completed.
Sounds perfect.
Any more questions?
She's been good?
Yeah.
Operative?
Yeah, she's been pretty good. Sarah, how are you feeling?
Pretty good,
Okay.
considering the circumstances.
Yeah. Well,
That's good to hear.
this is also Sarah. She's going to be your nurse this evening. I'm getting out of here. Did I miss anything?
No, you did pretty good.
Okay. Sounds
Alright.
good.
Do you want another blanket, or are you good?
I'm fine, thank you.
All right.
I've been pretty hot.
Okay.
Fever, yeah.
Yeah, we'll get you some medicine for that.
Okay,
All right.
thank you.
Thank you, Sarah.
We'll be back.